Good evening to all of you, and thank you for joining us. I am Catherine Alfano, the American Cancer Society's Vice President for Survivorship. The American Cancer Society is very pleased to be a partner on the BWEL Study. For us, healthy eating, physical activity, and managing weight are central to our mission to prevent cancer, save lives, and diminish suffering from cancer. I have the delightful job of welcoming you all to the call tonight. So let me start with a few housekeeping notes. If you have any technical issues during the presentation, use that lower right-hand Q&A box. Everybody look down, the lower right-hand Q&A, and send a message to all panelists, and our producer will help you find a solution to your problem. If you have questions about the content of the presentation during today's call, please type your questions in the Q&A box and be sure to send them to all panelists so that we can see them. And Dr. Ligibel tells me we will have time at the end to address all of your questions, or we will try to address all of your questions. Also, we will be recording the presentation and we'll send you all a link to it. So if anyone is frantically taking notes, don't worry, you'll be able to listen to the material again as often as you'd like to. And for anybody who missed the presentation last June, we'll also be sending you a link to that presentation as well. You can watch that one again. So without further delay, I would like to introduce you now to my colleague, Dr. Jennifer Ligibel from the Dana-Farber Cancer Institute, who is the lead investigator on the BWEL study. Dr. Ligibel is going to present to us this evening on yoga, acupuncture, and more, integrative therapies, and breast cancer. Dr. Ligibel, it's all yours.
Thank you so much, Catherine. We really appreciate the American Cancer Society's hosting our webinar series for the breast cancer weight loss trial. As many of you on the phone know, this is our second webinar. We had our first one last June, and like Catherine said, that focused on diet, and we will be soon posting links so that you all can listen to these again. And we'll do that going forward. So tonight I'm going to talk a little bit about integrative therapies. We're going to start by talking about, well, what are integrative therapies? And then review some of the research suggesting that these types of treatments can be helpful for patients with breast cancer during and after their cancer treatment. And then I'm going to finish up this evening by talking about one particular type of integrative therapies, dietary supplements, and what the research shows about the use of these products in patients with breast cancer. So to get started, we're going to think a little bit about what integrative therapies are, and this might be an unfamiliar term to some of you. Integrative therapies are treatments that are focused on the whole person and informed by evidence, but what makes them a little bit different than your kind of traditional cancer therapies, things like chemotherapy and radiation and surgery, is that really the goal of integrative therapies is to make use of all appropriate therapeutic and lifestyle approaches to achieve optimal health and healing. There are a couple of key concepts when you're thinking about integrative medicine, and the word integration is obviously a really important piece of this, and it means bringing together. So we're talking about bringing together our conventional cancer therapies with other types of treatments that can help support patients during and after cancer treatment, with really the goal to treat not just the disease, not just eradicate the cancer cells, but also to support the whole patient, to be holistic and to focus on healing versus just the actual treatment of the cancer itself. Now, there's not one definition of what integrative therapies are, which sometimes makes it a little bit difficult when you think about doing research or what's your advice to people about using these types of treatment during their cancer therapy and beyond. Some definitions of integrative therapy really include just about anything that's not a drug, surgery, or radiation. So it can go as far as including any kind of spirituality or any kind of special diet that someone may follow or the exercise that they do. So, I think that that's important to recognize that integrative therapies are definitely not a one-size-fits-all type of thing, but there are a number of treatment modalities that are usually viewed as integrative and that we'll focus on tonight during this session. One of these is acupuncture. Acupuncture can either be delivered kind of treating the whole body, or there are also focused types of acupuncture that you see on this slide where the gentleman is receiving acupuncture focused on the ear. Acupuncture has been delivered for thousands of years in the Far East and increasingly has been shown to be beneficial for patients during and after cancer therapy. And we'll talk a little bit about some of this evidence a little bit further on in the talk. One of the other forms of integrative therapy that's commonly used is massage, Reiki, and reflexology. And these are treatments that are really focused on relaxation and improving quality of life. Reflexology often focuses on specific areas like the feet or sometimes the head, whereas massage is more of a whole body experience. And Reiki often doesn't involve touch at all, but is more of an energy therapy. Integrative nutrition is also a part of many integrative medicine programs, and this focuses on herbs and supplements, which we'll talk about later, but also on concepts like mindful eating, being aware of what you're eating and thinking about food as being a part of your treatment for cancer or for other diseases, because what we put in our body makes a big difference in terms of how we feel and potentially how receptive our body may be to certain types of medications. So there's more and more study about how nutrition and medications and other types of things like that interact. Mindful movement is another part of integrative therapy, and certainly any form of exercise can be a part of integrative therapy and is a part of many people's lifestyles. Mindful movement is a type of exercise that involves not only physical activity, but also mental activity. So things like yoga and Tai Chi and Qigong that involve both the mind and the body in exercise. Creative arts is another area where there's emerging evidence about the value of these types of programs, art therapy and other types of expression therapy, especially for children with cancer, and some evidence growing in adult populations as well. Music therapy is another area where there's been a lot of study in terms of treatment of chronic diseases. Music therapy can improve mood. And then the last type of integrative therapy that we'll talk about a little bit is meditation and mindfulness. Meditation is obviously something that's been around for a long time, and recently there's also been a very large focus on mindfulness that's come from many sectors, I think in the corporate community, in the sports world, which we, in the New England Patriots country where I live, we're not really talking about the sports world right now, but I think that there's been an increased attention on being aware of where you are at the time being, really focusing on the now versus thinking about things that happened in the past or things that happened in the future. We're all so wrapped up in so many different things right now that it can be really hard to focus on the now, and that's really what mindfulness tries to bring people into their bodies with an awareness of what's happening to them at the present moment. Sorry, I have a little bit of a virus that my mindfulness is not helping me overcome at the moment. But I think one of the reasons why it's important that we think about these types of treatments in the setting of cancer therapy is that so many patients we know are looking to integrative therapies during and after their breast cancer treatment. There have been studies that show in cancer patients overall, 65 to 90% of patients are using some type of integrative therapy. In breast cancer patients, most studies suggest this is somewhere between 80 and 90% of patients seek out some type of integrative therapy either during their cancer treatment or afterwards. This was one study of a group of women who were living with advanced breast cancer, so receiving ongoing therapies, that looked at what percentage of these women were undergoing these types of treatments and what types of integrative therapy providers were they seeing. And you can see that almost all of these patients were using at least one type of integrative therapy. And this was a study that really limited the definition of what integrative therapy was. It wasn't looking at prayer, it wasn't really looking at mindfulness or exercise or diet, but really focusing on some of the core things like massage and acupuncture. They found that almost a quarter of patients in this study were using 3 or more types of integrative therapy. And on the right side of the slide here, you can see what types of providers patients were seeing. So almost half of them were working with a massage therapist. You had about almost 15% working with an acupuncturist, 9% a naturopath, 7.5% an herbalist. So a real variety, but most of the patients who took part in this study were using some form of integrative therapies to help support them during their cancer treatment. Now, one of the things that patients always ask me, given that I am a medical oncologist, so I treat people with standard Western therapies all the time for their breast cancer, is why do we need integrative therapies when we have so many exciting new drugs? I think it's difficult to turn on the news or open a newspaper and not hear about some of the exciting advances in oncology. We have targeted therapies and immunotherapy. So cancer therapy has come a long way, certainly since the time that acupuncture was initially invented thousands of years ago. And the question is, why do we need things like that that were developed really for a time when we didn't have effective therapies in 2018, when there have been so many advances in therapy for cancer? And I think one of the reasons that we really need these treatments today, just as much as we ever have, is because our therapies have gotten so much better. As treatments get better, more and more people are surviving cancer. They're not living weeks and months, but years after their cancer diagnosis. And in fact, in the United States, by 2023, there will be an estimated 20 million cancer survivors. And that is certainly something that is incredibly good news. But all of you who've gone through cancer treatment recognize that that's not the whole story. Although we've gotten better at treating the cancer, we haven't always gotten that much better at treating its after effects. We recognize that many people finish their cancer treatment, but for months and even years afterwards continue to experience side effects like fatigue and neuropathy and pain. And we don't have great solutions many times for these types of long-term problems with our conventional therapies. When we use a medication to treat a side effect from another medication, you can end up having side effects from that second medication that then need a third medication. And so sometimes people just decide it's better to live with the side effects than dealing with the treatment for them. And that's a place that integrative therapies have great appeal as treatment for cancer-related side effects. These things don't require a prescription. Many times they have fewer side effects. Supplements can be an exception to that, and I'm going to talk a little bit about that the last part of this talk. But many times things like acupuncture and massage don't have a whole lot of physical side effects. Patients often view these as more natural, too. After months and months of going through things that don't seem so natural, it can be very comforting to be thinking that you're taking something that comes from a plant. And I think that the most important piece of this is that integrative therapies can give patients a sense of control over their own health. There are so many things during cancer therapy that are out of your control. The chemotherapy you get, all the sessions of radiation. It's nice to have a piece of that that's something you research on your own and you look into and potentially do without necessarily going through the medical community. So there's a lot of appeal in integrative therapies to manage cancer and treatment-related side effects. But is there evidence that these integrative therapies can actually reduce the side effects of cancer treatment? It's great that these things can be empowering, but do they really work? I'm going to start with a little bit of an overview or the bottom line in terms of research into the value of integrative therapies in breast cancer, because I think it's important that we recognize that although people have been using acupuncture and doing yoga for thousands of years, research into how beneficial these types of treatments are has really started only over the last 10 to 15 years. So unlike cancer treatments where we've been doing large studies of chemotherapy and tamoxifen that have involved thousands of patients, and we've been doing these for the last 30 years, the studies of integrative therapies have been going on for a much shorter period of time, and they're usually much smaller at this point. We usually don't have a lot of studies that looked at 1,000 patients getting acupuncture. I think one of the other things that's important to recognize in these types of studies is that they're a little bit more complicated because it's hard to know what to compare something like acupuncture to. If you have medication, you can compare it to a placebo. It's really hard to think about a placebo of acupuncture, although we'll talk about some attempts at that a little bit later on. And the reason this is important is that many times people can feel better just because they know that they're doing something to try to help their side effects get better. And although that's not a bad thing, it makes it hard sometimes to know if you have a lot of things that haven't been compared to anything else, how do you direct a patient if they've got a particular problem, which of these things might be the most helpful for them? So I think it's important as we go in and start looking at this research to kind of recognize that these are some common problems in the studies of acupuncture and yoga and other things in terms of reducing side effects in breast cancer patients. The other thing that's important to recognize is that there's never been a study to this point of any of these integrative therapies in actually reducing the risk of getting cancer or the risk of cancer returning. That doesn't mean that there couldn't be some benefit in that way, but all of the studies that have been done so far have been much, much too small to support any claims that yoga cures breast cancer. So keep that in mind as we look at the research as well. So by far, the integrative therapy that's been studied the most at this point in breast cancer patients is acupuncture. And there are now dozens of trials that look at acupuncture as a remedy for a number of different cancer treatment-related side effects. One of these studies looked at the impact of acupuncture on the joint pain that comes from aromatase inhibitors. I know many of you on this call are probably taking aromatase inhibitors or have taken them. Joint pains are a very common side effect of these medications. I've had patients who tell me that they go overnight from feeling like they are in their 40s to they're feeling like they're in their 80s and can barely walk around because the joint pains can be pretty intense for some people. Some people, this leads them to stopping their treatment or to not taking the medications as frequently, and we know that's not a good thing in terms of long-term outcomes. So there's a lot of interest in trying to find ways to make joint pains and other symptoms more manageable. So this study enrolled women. It was a pretty small group of women. It was only 51 women, but they were all taking aromatase inhibitors and they had joint pain from the medication. And the study compared the effect of acupuncture versus sham acupuncture on joint pain. So before we look at the results, one of the things I want to talk about is, well, what is sham acupuncture? Because I think this is pretty important when we think about how well does acupuncture work. One of the things we really have to think about is, do we know why acupuncture works? So acupuncture, I think most of you probably know, involves needles. These are very, very thin needles. And what is done with these needles is that they're placed into specific points in a person's body that correlates to different energy centers for different symptoms. And you can see here, this is a schema of acupuncture points that are used to treat chemotherapy-induced peripheral neuropathy. So you can kind of see the distribution is close to the areas where there's where the symptom manifests, but not exactly right on that. So that's their specific points that are used. Then the needles are stimulated either by twisting them or by putting a very mild electric current through them, and usually they're left in place for 45 to 60 minutes. So if you're trying to think about what do you compare that to, it can be very difficult because if you're putting needles in specific places in someone, it's hard to disguise that. But there have been a number of attempts so that people aren't sure whether they're getting real acupuncture or not. And so the two types of sham acupuncture that have been developed are either you use needles that don't actually go through the skin, so you kind of put pressure in an area and then you just tape the needle on and it's not actually in the skin, or you put needles in places where you don't think they should be very beneficial for the problem that the patient has. And so in this study, they used needles that didn't actually go through the skin, but they were in the right spots. And what the study showed was when it compared women who had the real acupuncture with the needles that went through the skin versus the women who had needles that were just in the same places but not piercing the skin, they found that women who were in the acupuncture group had a reduction in the worst pain that they experienced. They had also a reduction in their overall pain severity. And I think most importantly, they had a reduction in the way that the pain interfered with their day-to-day lives. So women didn't know which of the two treatments they were getting, but the women who were in the actual acupuncture group had a real improvement in many of the different dimensions of the pain that they were experiencing from the aromatase inhibitor. So a small study, but potentially showing a real benefit of acupuncture in these patients. Now, another similar study that was done was looking at acupuncture to reduce hot flashes, which again, a very common side effect in women taking not only aromatase inhibitors, but also tamoxifen, which is about 3/4 of women with breast cancer. This study enrolled 120 women, again, who were already having hot flashes from taking these medications. And this time it randomized them to 4 different groups. There was an acupuncture group, Again, there was a sham acupuncture group, and this time the sham acupuncture actually used needles that went through the skin, but they put them in places that they didn't think would be that helpful for hot flashes. And then there were two groups of patients that knew that they weren't getting acupuncture, but they were taking other types of treatments that have been shown to be beneficial for hot flashes. So one group was taking gabapentin or Neurontin, and the other group was taking a placebo pill. So there were two groups in this study that we didn't expect to get a whole lot of benefit, the placebo pill and the sham acupuncture, and then two groups that we thought would probably have a reduction in their hot flashes. And the goal of the study was to see which of these groups had the best improvement in their the greatest improvement in their hot flashes. Well, what they found was, not terribly surprisingly, all of the groups had some reduction in their hot flashes. And this, again, goes along with what's called the placebo effect, meaning that if you feel like you're doing something for a symptom like this, many people do get some relief. And if you look down at the very last point there, patients who got the placebo pill, so not getting acupuncture and not taking gabapentin, had a 22% reduction in their hot flashes on this study. But all three of the other groups had more of a reduction. So the gabapentin group had a 39% reduction, and the two acupuncture groups actually both had, the sham acupuncture had a 45% reduction, and the real acupuncture group had a 48% reduction. So those two acupuncture groups were significantly better than the placebo and a bit better than the gabapentin, but there was no difference in this study between the sham acupuncture and the real acupuncture, which again shows you that we may not completely understand quite as well as we think we may how acupuncture works. But in this study at least, regardless of where the needles were placed, patients did have an improvement in their hot flashes. There have also been many other acupuncture studies in patients who were receiving treatments for breast cancer. I'm not going to go in great detail through all of them because for the most part these studies were a lot smaller, especially than the 120-person study that we just looked at. But there have been studies that have shown that acupuncture can reduce fatigue. There is emerging information suggesting that acupuncture can lessen neuropathy that comes from some chemotherapy drugs like Taxol. There are studies showing that acupuncture can reduce chronic pain, including things like stiffness and soreness that can persist for a long time in the arm after lymph node surgery. There are studies during chemotherapy showing that acupuncture can reduce nausea, and there are also studies both during and after treatment that acupuncture can reduce anxiety and stress. And all of this research has led groups to recommend acupuncture be a consideration for symptom management in cancer patients who are receiving treatment and beyond. So this is really the first integrative therapy that has been recommended by major cancer organizations to help reduce side effects in patients during and after their cancer treatment. So the other integrative therapy modality that has really garnered a lot of research in the last few years in breast cancer patients has been yoga. Yoga has now been studied in many different trials, and as we'll talk about in a future webinar, there is a lot of evidence that suggests that exercise is beneficial, and those are many, many big studies. But yoga has been singled out, and I think, again, it's because it involves not only the physical component, but also the mindfulness component, and there have been a number of studies now that have looked at yoga as a treatment for some of the most difficult to manage side effects in cancer patients. So this was a study, and it was a large trial, 410 women who were having trouble with sleep after finishing chemotherapy and radiation. We recognize that many, many patients will have sleep difficulties during their treatment, and many times these don't go away when therapy ends. So this was a study that looked at post-treatment cancer survivors. The study was all women. 75% of them had breast cancer, and then there were a mixture of other cancers. And patients were randomly assigned to participate in a program called the Yoga for Cancer Survivors, or YOLCAS program, or to a stretching comparison group. Now, any of you who've done yoga know there's a lot of different kinds of yoga, really ranging from almost pure meditation up to things that are like yoga to make you sweat and grind your teeth. So this was somewhere in the middle. It involved a mixture of gentle hatha yoga and restorative yoga. The sessions included alignment postures, breathing, and mindfulness exercises, and it was taught by an instructor twice weekly for 75 minutes over an 8-week time period. And what they found was that the patients who took part in the yoga program had improvement in all different types of sleep measures. The quality of their sleep, which means how often they woke up, how rested they felt in the morning, their daytime sleepiness. They also had a reduction in the use of sleep medications and a reduction in the time that it took to fall asleep. So really showing that yoga led to improvements in sleep. And the other thing that was really interesting about this study was that the benefits of yoga lasted for months after the program ended. So really showing that this type of restorative gentle yoga was very beneficial in these patients that were having sleep problems. Another large study looking at the benefits of yoga in breast cancer patients focused on the ability of yoga to treat and prevent fatigue in patients receiving radiation. So this was a study of 163 women who were starting radiation for breast cancer, and they were divided into 3 groups. There was a hatha yoga group, and they took part in that program 3 times a week for 6 weeks, so during the entire radiation period, a stretching group, and then a group that just got usual care information about the importance of sleep and exercise and nutrition during their radiation. So compared to the usual care and stretching group, women in the yoga group had better physical functioning, less fatigue, and not only did they have these improvements in these types of things that they were reporting themselves, but they were also shown to have a greater reduction in stress hormones. And we think that stress hormones are related to the amount of fatigue that women experience, and especially sometimes to the fatigue that persists after the treatment is ended. So a short-term yoga intervention was shown in this study to have potentially long-lasting effects in terms of reducing fatigue and stress in this group of patients with breast cancer. Now, there are emerging studies looking at other integrative therapy modalities. This is a synopsis of some of the more recently published studies looking at the value of Tai Chi and Qigong, which are somewhat similar to yoga in that they involve both movement and meditation, but it's a little bit more structured practice. There was a recent review of studies that found 15 trials of Tai Chi and Qigong in cancer survivors, and most of these focused on or included breast cancer patients. These trials tended to be small, but a few of them involved more than 100 patients. About half of the trials were performed in the U.S. and half were performed elsewhere. I will say as an aside, it's quite striking if you're traveling in some parts of the world. In China, for example, early in the morning, you can see hundreds of patients out practicing Tai Chi and Qigong in parks. So this is definitely something that is more popular in other parts of the world than it is here. But in these studies, Tai Chi and Qigong were also seen to improve some of the same types of symptoms that yoga improves, things like fatigue and sleep difficulty, depression, quality of life. So again, suggesting that this is probably not a one-size-fits-all phenomenon, and oftentimes if you can find an integrative therapy practice that resonates with you, that's probably the one you should pursue. I often have my patients ask me, what's the best type of practice, what's the best type of exercise, the best type of dietary program that I can be on, and I always tell them it's the one that you're going to stick with doing, because I think that the persistence for many of these things is really important in terms of especially having a long-term relief from these types of side effects. So in terms of an overview, I think, again, there are very few at this point large randomized trials showing benefits of integrative therapies, but this research is really starting to grow. And in fact, last year alone, there were 5 big trials published looking at yoga in cancer survivors. So this is really an area of active research, and more really showing that especially acupuncture, yoga, and starting to be Tai Chi and Qigong can have real value for cancer survivors in terms of reducing the side effects and toxicities that they're experiencing from their therapies. And again, I also think this highlights the importance of supporting ongoing research and really figuring out which types of these therapies may be best for alleviating specific side effects. And that kind of gets me to the next part of this talk, which is how can you decide if integrative therapies are right for you? There are so many different types of integrative therapies to choose from. Where do you start if you're someone who's experiencing ongoing side effects from cancer therapy, or someone who just is interested in potentially enhancing quality of life in the post-treatment period? And this is a place where I really think that integrative medicine consultations can be helpful. More and more cancer centers are offering integrative medicine consultations. These are usually provided by either a physician or a nurse practitioner or physician's assistant with training in integrative medicine, either a fellowship or a certification. And what they can do during these consultations is really figure out what are the side effects or the symptoms that you're most interested in addressing and trying to match those to where the evidence shows that there's actual benefit. I think there's never harm in trying a bunch of different therapies out, but if you're somebody who's really suffering from neuropathy, for example, pursuing a creative arts class may be beneficial and enjoyable, but it's probably not going to help with your neuropathy. So finding the right fit for the symptoms you have can be one reason to seek out an integrative medicine consultation. And the other reason why I often send my patients to meet with an integrative medicine provider is to really think about supplements, because many patients are taking supplements, and I think it's really important to recognize that there can be interactions with medications like tamoxifen and the aromatase inhibitors. And so this is something that integrative medicine providers are able to go through these lists of supplements and to look for interactions through some of the comprehensive databases that exist about interactions with cancer medications. And so I want to finish up tonight by talking a little bit about supplements specifically, because there has been a lot of research in the last few years that show that up to 88% of women take supplements after a breast cancer diagnosis. There's a lot of reasons when asked why people say that they're interested in taking supplements. Some of these are that they are looking for things to strengthen their immunity, especially after going through chemotherapy, or to help alleviate some of these side effects that are persisting after treatment ends. Patients sometimes are worried about nutritional deficiencies, especially patients who've had chemotherapy and have had a lot of GI issues with that. And then also, patients are interested at times in trying to help improve their prognosis. And this is one area where I think it's important to recognize the difference between supplements and medications. We've all seen ads for pharmaceutical medications on TV where they have sort of this glowing, very excited person talking about the medicine, and then the last half of the commercial is filled with all of those disclaimers about if you have this, this, and this happen, and they always talk really fast, and there are all these words that are scrolling on the bottom of the screen. And the FDA makes the manufacturers of medications do that, but you never see that for supplements. And the reason is that supplements are not regulated by the FDA. And that means that they don't necessarily need to back up their claims. So they can tell you this may help treat your cancer, but they don't actually have to do research showing that that's true. The other piece that's important to recognize is that the FDA doesn't make sure that what they say is in the supplement is actually in the supplement. So if you're going to take supplements, it's just important to kind of keep those things in mind, that sometimes manufacturers make claims that they don't necessarily have great research to back up, and that you want to make sure that you try to buy them from a reputable source to make sure as much as possible that that they say is in the pill is in the pill. And I think this kind of gets me to my next point. I think that there sometimes is this sense that since a supplement is natural, that means it couldn't be harmful. And this was a study that came out last year that looked at the number of emergency room visits related to supplement use at 63 hospitals in the U.S. And they estimated that each year there are about 23,000 emergency room visits and about 2,100 hospitalizations due to adverse events from supplements. The types of supplements that often lead to ER visits are things like herbal therapies or nutritional products, and sometimes vitamins. And the most common problems especially come from weight loss or energy products where people develop heart problems, and this tends to happen in younger adults. And in older adults, choking from vitamins is very common since they're fairly large pills often. So this doesn't mean that you shouldn't take a supplement, but it also means that just because it's natural doesn't mean that especially if you take more of them than you should have, that they can't cause harm. Does this mean that nobody with breast cancer should take a supplement? And I also don't want that to be a take-home message from tonight, because there are some supplements that we think may be helpful for women with breast cancer. And the best studied of these is vitamin D. Some of you may be aware of the many headlines that suggest that vitamin D may be an important thing in both preventing and treating breast cancer. And I wanted to just spend a couple of minutes looking at what do we actually know about vitamin D and breast cancer. Most of us know that vitamin D, which they also call the sunshine vitamin, can come from the sun. So if you get sun exposure, your skin actually makes vitamin D. But you can also ingest vitamin D both through food, and a lot of foods are vitamin D fortified, and then through supplements is another key way that people get vitamin D in their diets. And there have been a lot of studies that have actually looked at vitamin D and the risk of developing breast cancer. And we do know that some studies have suggested that women who have a higher level of vitamin D in their blood actually have a lower risk of breast cancer. So when they look at groups of women who have developed breast cancer and they compare them to women who haven't, they often find that women who have breast cancer seem to have lower vitamin D levels than women who haven't. And so this led to interest in doing a study to actually see if you could give vitamin D supplements to patients and see if that would decrease their risk of developing breast cancer. And this was a big study that was conducted now about 20 years ago called the Women's Health Initiative. And in this study, it was a randomized trial. They either randomized women to take a vitamin D supplement or to not, and then they followed them to see if there was a reduction in the risk of getting breast cancer if you took the vitamin D supplements. There were a couple problems with the study. One was that the supplement dose of vitamin D that they gave women was fairly low. It was only 400 units of vitamin D, and now we often recommend that women take 1,000 units just for bone health. So it might have been a little bit of a low dosage of vitamin D. They also didn't tell women who were in the comparison group that they couldn't take vitamin D, and so this caused a little bit of messiness when they were trying to sort out the link between vitamin D and breast cancer risk, but they did not see that the women who were in the vitamin D group had a lower risk of developing breast cancer. And they also found a couple of other interesting things in this study, and one of them was that the amount of vitamin D that women were taking as a supplement didn't have a very large impact on the women's blood vitamin D levels. They found, in fact, that the vitamin D level in your blood was more related to your weight and the amount of physical activity that you did. So people that were more active and leaner had higher vitamin D, and women who were less active and heavier had lower vitamin D. They also found that there was a link between where people lived and their vitamin D level, and this isn't a big surprise because we know that vitamin D is called the sunshine vitamin, so if people lived in sunnier places, they had a higher blood vitamin D level. So this has led to us not telling women that taking vitamin D is a part of a cancer prevention strategy, but there's still a lot of research going on trying to figure out if maybe they looked at higher levels of vitamin D supplementation, whether that might make a difference. Well, what about women who've already had breast cancer? And there's been some research that has shown that vitamin D deficiency is pretty common in women with breast cancer. Now, as one caveat, this was a study that was done in Canada, and we just saw that vitamin D levels are higher in sunnier places. And unfortunately, and I don't know if any of our Canadian participants are on the phone or on the webinar tonight, but Canada unfortunately tends to get a bit less sunshine than many places in the United States. But that aside, they found in this study that almost 40% of women, breast cancer patients in this study, had vitamin D deficiency, and another 40% had kind of borderline levels. They found that levels were lower in patients who were premenopausal. Again, the relation, we don't completely understand why, but there's a relation between vitamin D levels and body weight. They found that vitamin D deficiency was more common in women who didn't have as much vitamin A, vitamin E, and whole grains in their diet, and the women who drank alcohol regularly. Now, in this study, they didn't show a significant relationship between vitamin D and cancer, any other cancer outcomes, but they did find this very high level of vitamin D deficiency, which is important because we know that vitamin D is important for bone health, and we know that some of the treatments that we give women for breast cancer can cause difficulties with bones as well. So I think it's important to recognize that some women, especially women taking an aromatase inhibitor, might benefit from vitamin D in particular, and potentially calcium, depending on how much calcium women are getting in their diet. I think it's important to recognize that beyond vitamin D and calcium, if you're thinking about a supplement, take a look at that. And if it makes a claim that sounds too good to be true, it probably is, because, again, supplements are not regulated by the FDA. I think the other thing is that it's just important to talk to your doctor about supplements. In my own practice, I have a lot of patients that take supplements, and I think that that's fine as long as they don't necessarily interact with other medications for their cancer that we know are important, like tamoxifen or the aromatase inhibitor. So integrative medicine consultation or working with your doctor just to make sure that there's nothing in the supplement that you're thinking about taking that could be harmful in another way. So, summing all of this up, I think that it's important to recognize that integrative therapies are a part of the lives of many patients after breast cancer diagnosis. And I think that the thing that's exciting is that over the last decade, we've really gotten more and more evidence that integrative therapies, especially things like acupuncture and yoga, can help reduce symptoms in breast cancer survivors, many times in a long-lasting way and in a way that doesn't cause a lot of other side effects. We clearly need more research to figure out what the benefits of other therapies are and to figure out what's the best treatment for a particular problem that patients might be having. Again, supplements are generally not recommended, but work with your doctor if you're interested in taking them, and seeing an integrative medicine provider to help figure out what type of integrative therapy could be helpful. So that is all that I have tonight. I really want to thank you for your attention on the part of all of us here at BWEL. And I think we have plenty of time for some questions. So I encourage you to type in your questions here in the box, and we will try to get to as many of them as we can.
Great, thank you, Jennifer. And if you want to turn the screen back to where people can see the Q&A box.
I'm trying to figure out. Oh, there we go. Sorry.
Perfect. Okay, so just make sure, everyone, when you're putting in your questions, that you make sure that you select all panelists, and then we will see them and can take your questions. I'm scrolling through now, trying to make sure that none of them came in. Ah, here's one. How would I go about finding a reputable acupuncturist?
So that is a great question, and I think that it's one of the things that there is not always the same standardization with some of these practices as there is with, say, an oncology provider. Or a radiation oncologist. So one of the things I recommend is checking with your cancer center. Many cancer centers now have acupuncture providers on staff that can work with their patients, and if not, they may have a list of area providers that they can work with. There are also licensing bodies in most states that have acupuncture credentialing for providers, and that's another way. It's different state by state. I know in Massachusetts there's an acupuncture school here that keeps a list of actively credentialed individuals. There is also a group called the Society for Integrative Oncology that is a consortium of academic integrative oncology programs across the United States, and they're also working on putting together a list of oncology acupuncturists across the country, and I hope that will be available within the next year or two. But you can check that website as well for individuals who belong to that society that may live in your local area.
Okay, several questions coming in now. So another one on acupuncture. Is it safe to have acupuncture after lymph node removal?
So it is, but they may recommend that you don't have needles placed in that arm. I think that there's kind of ways of working around putting acupuncture needles in the arm after you've had lymph nodes removed. So many times we would choose positioning that included the other arm or other parts. I am not an acupuncture provider, but my acupuncture providers do tell me that there's a recapitulation of a large part of the body on the ear, so that's always safe, no matter what type of lymph node surgery you had. So it is important to talk with the acupuncture provider about whether they've worked with cancer patients before and their understanding of the surgery that you've gone through.
just underscores the need to have someone who really knows what they're doing with regard to cancer survivors. Another question is, any thoughts on using essential oils or other oils to help with side effects?
You know, there's not a lot of research into the essential oils. I think they're very interesting. They kind of fall in the same category as supplements and functional foods, but where there's just not been a lot of research that's been done to date.
Question on vitamin D and dosing.
That is a wonderful question,
yeah.
and that has actually been something that has been hotly debated in medical circles. There's actually been even a lot of debate about what even is vitamin D deficiency, and the Institute of Medicine has lately come back and said that the levels we've been aiming for are probably higher than we actually need to support bone health. So, you know, I recommend often that people will get a vitamin D level checked. If their level is less than 20, then they actually need to be repleted, and that is a very different algorithm from just general supplementation. That involves very high doses given once a week. For a patient with a vitamin D level above 20, the usual recommendation is 1,000 to 2,000 units of vitamin D a day. I don't recommend a supplement of more than 2,000 units of vitamin D daily. You can actually have too much vitamin D. So usually for most people, 1,000 units a day is sufficient.
Okay, another question on acupuncture. Someone who's completed treatment for triple-negative breast cancer wondering, do you think acupuncture would help with my overheating problem? It's not hot flashes, just seem to overheat very easily.
So I think people experience the temperature changes related to menopause in different ways. So I think it's certainly worth a try to see if they could use a hot flash algorithm and see if that would be helpful. Because there have now been, in addition to the study we looked at, there have been a number of other studies looking at the value of acupuncture in hot flashes and in night sweats. So I think that if it has a common etiology for what's causing that symptom, it would certainly be feasible that the acupuncture would be helpful.
Okay, and here's a question on, will the presentation be sent to study participants? Yes, we are going to send this presentation out. Jennifer, do you have a take on how long that will take us to do?
I am hoping that it will be within the next month or two. We do have, the study is going through some changes at the moment. We are opening the study to Spanish-speaking patients, and we also will be rolling out some improvements to the intervention with additional study materials, and so you all will be hearing about that soon. So we've been working on that for a bit of time, and then as soon as that is taken care of, our next kind of area of attention will be to get the links out for these webinars. We will need to post those on a secure YouTube channel, so it's just been a little bit more involved. We are also hoping, we do have these webinars every 6 months. I think we are hoping to focus on sleep in June, but we are also really interested in hearing from all of you about what types of topics you might be interested in. And so when we do roll out the new enhancements in the study, we'll be starting a BWEL mailbox where you can send in your ideas for topics to be covered in both the newsletters and in the webinars. You all should be receiving your winter newsletter, I'm hopeful, by the end of this month.
Okay, and the presentation from last June will be sent out about the same time that we send out this one, is that correct?
Yes. Yes.
Perfect. Okay, another question. Yes, you didn't touch on this one, medical marijuana. Any research on the use of medical marijuana supporting these sorts of symptom management?
Very little research on medical marijuana for a variety of different reasons, most of which are political. I think that there are, the evidence, the research into marijuana that has been done is more focused on the during treatment period and focuses on nausea. There's not as much information about marijuana in cancer survivors. So I think, unfortunately, there's just not a whole lot of information at this point. Okay, I think you have answered all of our questions. Wonderful. Well, thank you all so much for joining us tonight. Thank you for your continued participation in BWEL. We now have more than 1,000 participants on the study, so we are really looking forward to continuing these webinars and hopefully giving you information that's helpful to you as you go through the next years. So thank you all very much and have a good night.
Bye-bye.